obesity is something that is it's a prevalent problem, but even though it's so common, it's associated with a lot of anti-obesity stigma and discrimination. So many people who are obese feel and perceive and have been repeatedly treated poorly or unfairly because of their excess weight. And that actually backfires. That doesn't lead to people developing more healthful lives and eating better and exercising more. And it makes people feel badly about themselves, and it often leads to them seeking less preventative care, less treatment. So one thing is, at the broad level, people becoming increasingly aware, people at the societal level, and also healthcare providers who are in the field and in the business of helping people should be increasingly aware of both explicit and implicit forms of biases against people with excess weight, and to counter those attitudes. The other thing with binge eating disorder is the awareness that even though a lot of the problem is described as overeating while feeling out of control, many of these individuals have very significant body image disturbances, so they feel very negative, they feel very badly about their bodies regardless of their weight, and their weight and shape are really amongst the most important things that they use to evaluate themselves as human beings. And because of that, they feel very badly when they can't control their eating, or they don't control their eating, or they put on weight, and they feel absolutely disgusted with themselves. And I realize disgust is a strong word, but those are the terms that the patients share with me. So this is a problem that greater recognition by clinicians in a variety of general health settings would be useful, because people who struggle with binge eating disorder often do so in isolation and in secrecy and in alone. Their partners, their family members, their best friends often don't know that they are struggling with this alone. And recognition of these factors by healthcare practitioners is a useful way to, in a compassionate and empathic way, begin the conversation with their patients, rather than just saying go on a diet, but to begin the other way, which is, do you have concerns about your weight? Do you have concerns about the way you eat sometimes, or some of the eating patterns you might have? Can you tell me about those? That kind of open, less critical and compassionate way of starting a conversation with a patient can, I think, help greater recognition and a therapeutic relationship.